Reliability refers to the consistency of a measuring instrument. Iterated reliability was done by Carson in 1991. He claimed that DCSM-3 had fixed the problem of iterated reliability, as this should have led to greater agreement over who did or who did not have schizophrenia. Test-retest reliability was done by Wilkes et al. In 2003. He administered 2 alternate forms of the test to schizophrenics over a period of 1 to 134 days. The correlation was 0.84. This is supported by Prescott et al. In 1986, who analysed the test-retest reliability of several measures of attention and information processing in 14 patients, and found performance to be stable over a 6-month period. Evaluatory points for this are Arby and Nicholson in 1995 asked 50 senior psychiatrists in the US to differentiate between bizarre and non-bizarre symptoms. Iterated reliability was only around plus 0.4. Chenot in 2009 compared DCSM and ICD and found the iterated reliability was above 0.5 for both, and schizophrenia was diagnosed more using ICD-10. Rosenhan in 1973 also conducted a study where normal people presented themselves to US psychiatric hospitals saying they had voices saying empty, hollow, or thud. All were admitted, none were detected by staff, but some other patients did notice that they were faking. Validity refers to the extent that a diagnosis represents something that is real and distinct from other disorders. Comorbidity is the extent that 2 conditions co-occur. Buckley et al. In 2009 estimated that comorbid depression occurs in 50% of patients and 47% of patients have comorbid substance abuse. This makes treatment difficult. Kloster-Kosse et al. In 1994 assessed 489 admissions to a psychiatric unit in Germany. They found that positive symptoms are more useful to diagnose schizophrenia. This is supported by Ellison and Ross in 1995, who pointed out that people with dissociative identity disorder have more schizophrenic symptoms than schizophrenic. Evaluatory points for this are ethnicity and medical complications. For ethnicity, Harrison et al. In 1997 reported that the incidence rate for schizophrenia was 8 times higher for African Caribbean groups than for white groups. Medical complications were studied by Weber et al. In 2009, who examined nearly 6 million hospital discharge records. Psychiatric and behavioural-related diagnosis accounted for 45% of comorbidity, suggesting that being diagnosed with a psychiatric disorder leads to a lower standard of medical care.